Welcome to Interdisciplinary Case Miles, a podcast where real runner stories meet clinical expertise. We discuss real cases that are anything from weekend warriors all the way to elite athletes, while using our evidence-informed approach.
I'm Dr. Sara Raiser, a running medicine physician focusing on helping runners prevent and recover from running-related injuries while optimizing health and performance.
I'm Kelsey Pontius, a sports dietitian helping runners to fuel smarter, recover better, and help avoid the risk of injury so that they can meet their goals.
And I'm Dr. Mihevc Edwards. I'm a physical therapist and orthopedic specialist, and I've been treating for runners for over 15 years. And what I do is help them get back stronger and better. Today's case is a pretty interesting one. Of course, I probably always think that, but it's a 23-year-old male who was a collegiate swimmer. So he was a collegiate swimmer for all of college, and now he's out of college and he's training for his first marathon. He used to run a little bit in college, and after graduating, he was running about 15 to 20 miles or so a week. But 4 months ago, he started training for his marathon, and he upped his mileage to about 40 miles a week. And then he also changed some of his training. He started doing hills and speed work, so things he had never really done before in the past. He presents first to Kelsey because he is worried about his iron and his ferritin. He'd been doing a lot of Googling, of course, or asking ChatGPT, and he remembers from when he was in school that people were talking a lot about iron and ferritin. And what he presents to Kelsey with is that he is just training really hard and he's not getting as fast as he would like. So Kelsey, could you please take this?
Yeah, this is a really, I would say, common case that I get an email about, being concerned about ferritin anywhere between 2 to 3 times a month. So oftentimes when a ferritin case is brought to me that they're concerned, maybe because of past experience, or they have labs and they do know their ferritin is low, they're just concerned about this one variable, right? And so this athlete is complaining that he's putting in all of this work and new stimuli, but he's not getting faster. And so he thinks if he can just fix his ferritin, then everything else will sort itself out. Because with ChatGPT, if you haven't figured this out, you have to know what questions to ask to get a good answer. So they said, just fix the ferritin. So he is reaching out to me to ask how, to restore his ferritin levels. But the way that I would bring him through a nutrition assessment would be making sure that we're backing up and taking a broader look than just the ferritin alone, because oftentimes once ferritin storages are impacted, other things are impacted too. And instead of that being the main diagnosis, it's more of a symptom of a bigger picture. And so to determine if it's just ferritin alone or a bigger picture, I would be asking him questions such as his past injury history. How is he sleeping? A lot of times when we are experiencing low energy availability, or just the calories that we're taking in don't match what we're outputting, sleep can be an acute symptom, acute and chronic, but that's one of the early warning signs. Low ferritin storages, I would also consider that oftentimes an early sign of low energy availability that can turn into REDs. I would ask him about his libido. With male athletes, we ask about not only sex drive, but morning erections. I would be asking about his recovery between sessions. And so that would kind of give me a good picture of if it's a bigger low energy availability issue. And sometimes when it's ferritin too, it's interesting to also ask if they're experiencing any kind of GI issues, either during the run or even symptoms such as constipation, or oftentimes runners will tell me after they run, they'll have bouts of loose stool after they run, because oftentimes that can be symptomatic of low energy availability, but also if they're having GI issues, they might not be absorbing iron and able to transport it into storage forms. I won't dive too deep into this, but just so that everyone knows, iron and ferritin are different. Iron in our blood serum, whereas ferritin is the storage form of iron. And so when our iron storages get low, then oftentimes the goal is that the ferritin kind of comes in and repletes those blood serum levels. The blood serum levels change more, I would say, acutely, whereas ferritin storage is slower to change. So ferritin definitely is more of low ferritin levels are definitely an acute form. So yeah, I would go through that workup and kind of see what he's dealing with. And is it just a ferritin issue? Does he need to see someone specific, like a gastrointestinal doctor for GI related issues? Or is it something that I think that nutrition therapy, we can address and restore those values? There's a big connection between bone density and bone stress injuries and ferritin too. And whether that connection is, ferritin, iron helps to make hemoglobin, which transports oxygen. And so if that affects the bones, or if it's just a the bigger picture of low energy availability, why those are oftentimes tightly connected. So he does complain that he's having some pain in his thigh. And so I will I'll let you guys decide, Kate or Sarah, because I guess that he could, present to you with thigh pain to either one of you. So.
Well, why don't you take it, Sarah, and then I'll follow up with it.
Yeah, great. So if I saw him in the clinic, they probably would come in and say, I was sitting here, I'm having some thigh pain. Someone thought it was, more significant maybe than I did, and I just want to get checked out. Thigh pain in a distance runner, I take oftentimes pretty seriously. They'll come in and say, I have a quad strain. Like, as a distance runner, like, not usually. Now, is it possible? Sure. But usually when I'm seeing thigh pain, it's something else. It's either the femur, so femoral shaft stress fracture, something I'd want to rule out, or is this something coming from the back or the hip? So usually this is something more significant than a muscle strain. So certainly would work them up for a stress fracture in this particular scenario. He gets diagnosed with a femoral shaft stress fracture. And I think there's a lot of different components of this case that are really significant. So one is, we've talked about some of the nutritional pieces, which are very pertinent when it comes to bone health and their risk for bone stress injuries. This is also a swimmer who is fit for a water sport that is horizontal and anti-gravity. And oftentimes these athletes come out of the water with incredible cardiovascular fitness, but they haven't been loading their bones. And so being able to transition to loading their bones and building that bone strength to be able to tolerate something like 5K versus a marathon, which is a really big distance. And so oftentimes these athletes, I think, get carried away pretty quickly because they are already so stinking fit. And so I oftentimes have to kind of slow them down if I can meet them before they end up with a bone stress injury. But really taking that context, and if you don't ask them about their prior history, you may not know that this was a collegiate swimmer, and you're missing a really big component of this. So things I think about when someone has a stress fracture. So in this particular scenario, I talk about the 3 pillars like a nerd. Tell them that we're talking about nutrition, we talk about training errors, and we talk about biomechanics. In this particular case, nutrition would be first, and the front piece of this. And fortunately, this athlete came from a sports dietitian that I trusted, covered a lot of the concerns that I have. I would definitely want to address training errors. And I know Kate will also echo a lot of these things that we want to ask how quickly they're building their mileage. We want to think about the bone density piece in their past history. Probably wouldn't recommend 4 months training into a marathon out of the gate of coming off a collegiate swim career. And then we also even talk about, how many days a week are they training? Are they still cross training? Are they swimming? Are they doing strength training? Have they done anything specifically to make that transition from water to land? And then we can talk about biomechanics for sure. I always do a biomechanical screen, and certainly there can be things that are going on, but the femoral shaft is a pretty darn big bone. So I always tell folks when I see them in the office, if you have done enough to actually have a stress fracture across your femoral shaft, it's a big deal. Now, these injuries usually heal up just fine, given the appropriate amount of rest, the building blocks, nutrition. This thing's going to heal. I usually do a period of non-weight bearing, but it's a little bit less strict than a femoral neck stress fracture, which is a high risk critical site injury. But these are pretty serious, and we really want to make sure, if these folks have low energy availability, which they usually do, it's actually usually pretty intense. So they usually come in with a low ferritin, and we've got a lot of other big picture things that are going on that this didn't happen overnight. So a collegiate swimmer oftentimes is putting in many, many hours of training. And so they are also going to be at risk for having low energy availability. And so that will be a big component that we address here. But for this athlete, we'd get an MRI. We make sure they don't have a stress fracture. If they do, then we're putting them through that protected weight bearing period. And I am getting all of my comrades on board. So getting our trusted physical therapist and dietitian on board. Because honestly, I don't do much as the physician when it comes to simply the diagnostics and the recovery. A lot of this ends up coming to the PTs and dietitians. And so my job is to make sure that I'm convincing them of the importance of all of these things. And I always make sure too, with the ferritin piece of it, I try to make it pertinent. So, iron makes up your hemoglobin, which carries your oxygen, and you are an aerobic athlete. So imagine why that should be important. This particular athlete came in interested about his ferritin, but it's not always that scenario. And ferritin is not just iron deficiency anymore. I think we used to think about that. We give someone an iron pill, here you go. But ultimately, it's reflecting their relative carbohydrates and their relative energy availability as well. The other thing is this is a male. And so a male with low iron, I'm always going to have that. My spidey senses up to figure out, is there something else going on that's not just low energy availability? Like Kelsey, you mentioned GI and some of those other pieces, but is there something else that we need to look into? Technically cancers can show up with anemia and other bigger picture medical problems. And so especially in a male athlete who's not menstruating and losing blood, we want to make sure that we're also ruling out those pieces. So the degree of low ferritin or iron deficiency is really important to consider as well. I've talked a lot, so I'm going to pass this over to Kate because I want to know what Kate has in terms of her concerns of biomechanics, and then also how you're doing potentially coming off of crutches, because I love when I get to work with you and I can just basically throw it to you and let you do that process, plyometrics, getting them back to running. And I think that's a really unique process as well.
Awesome. Thanks. So I would definitely start this person before they were fully weight bearing, but not obviously with a return to run program, just for PT and strength, probably if they're not doing it on their own. So core stability, exercises that aren't going to impact that femoral shaft. And we might be doing basic things for the foot and ankle in a seated position. You never know, depending on exactly what the precautions are from Sara or somebody else. So you can start PT before you're ready to run is something that I do like to tell people. And also PT is a lot of education, especially in a clinic like mine, where we see all runners. That training error piece is so huge when we're talking about injuries. There are so many things that happened in this particular case that we need to address. So there was a major spike in their training. They increased their training by 50%. 50% is a huge number. They also added different types of exercise or different types of training, hill repeats, speed workouts that they had never done. So one of those workouts alone could be a major spike in their training during a week. So that's part of the training error. He didn't mention how many times he was doing cross training or if he was. I would want to know, was he taking any rest at all? Most likely not, because if you're coming from a collegiate athlete background where you're pushing all of the time, you probably didn't have as much rest as you might have needed. And now you've entered the world, you're working. We've talked about this before. You have all these different stresses on your plate that you didn't have before. You probably have to cook for yourself for the first time. You don't have an athletic trainer that you probably had to work with before. And so you're trying to figure things out on your own. So all of these pieces are things that we talk about from an educational standpoint, or therapeutic activities is what we call them in PT. So all of that we need to discuss. We also need to know, was this athlete doing any plyos? Were they doing any strength training? What were they doing to load their body? Because these collegiate swimmers, they are not land animals. They are in the water. They're fish, and they're not used to moving on land, so they move differently. If you watch a collegiate swimmer turn runner do a squat, it looks incredibly different than somebody who's been doing exercise on land all the time. So those are things that we're going to need to look at after the injury, but some of those things we can look at beforehand. And so I'm going to be thinking about all of these different things when they're coming back to me. And Once I get them and they are cleared to run again or cleared to begin the return to run process, so that might mean walking first, I'm going to start looking at how do we load that bone properly so that we can do it safely. And that might be, as simple as pogos, which is just jumping up and down, bilateral or single leg. It might be squat mechanics. It might be looking at different strength exercise, eccentric loading of the quads or the hamstring. So working on all of that. And then we're going to build a return to run program, which is both running and walking. And the question is, are they with a bone stress injury, we want them to be able to do plyometrics because running is essentially jumping up and down in one place, right? But if we're doing a run walk in the beginning, they may not be able to pass all of the plyometrics at first, but that's okay as we bring them through that run walk. It's just part of it. And we may also do some kind of body weight assisted training so that we can offload the body a little bit, but they can still get the force through their body. I might add blood flow restriction training as long as we're cleared to increase the strength of the muscles and the tendons. So they're really, I could keep going about this, but there's so many different ways that we would address this. And I would make sure that we have good rotational stability. Somebody with a femoral shaft fracture probably doesn't have good rotational stability. And so I'd have to look at their pelvis. Do they have pelvic drop when they're running? Most likely, because again, they're not land mammals. How is their arm swing going? What's happening with their foot? Are they overpronating or is it too fast? So there are a lot of things to look at here, and all of it seems really fun to me. And it's such a good process to get an athlete like this because they are excited to learn about it too. But we would definitely do a breakdown from plyometrics, strength, mobility, and run gait.
I was just going to ask, because I've seen the swimmer turn distance runner play quite frequently. Can one of you kind of explain how when you've grown up doing a sport such as swimming that you're not weight bearing, and then you switch to that, post collegiately, why that's a different demand on the bones and how your bones aren't used to it? I guess it's your whole maybe I'm oversimplifying, but I just think this is so cool about bones. I love bones.
Yeah, one thing I did mention is that with the femoral shaft stress injury, it's not considered it's considered a medium risk injury, right? It's a really big bone and we've got some concerns about low bone density with it, but it's also not considered a critical site, meaning we expect it to heal up. It's got good blood supply, it's compressive forces, but it definitely makes us concerned that they could have low bone density, and definitely with a history of all the swimming, I worry there can be low bone density. So we build bone density with gravity and being weight bearing. We also build it from muscle pull, right? So the other thing I think is really important too is during adolescence and the cutting and lateral movements, we also change the shape of our bones as a result of that. So that's why there's, you've heard about the movement of really trying to get our young athletes definitely doing multiple sports, but making sure they're also doing multi-directional sports because that helps build bone in many different directions. So when someone isolates or specializes in a particular area, like a runner or a swimmer, someone who's doing endurance sports, a lot harder to do multiple sports at the same time, I think is part of the reason this happens. But then you start really training in more one direction. And so the shape of the bone is going to get a little bit different. So if we can build bones during that really big spike of puberty and adolescence, and really get that big, get them strong in multiple directions. That's going to be a really important thing. And we don't really hone in on a lot of that. We do have devices that we can actually look at the shape, the geometry of bones, but it's not something that's kind of standard practice. That's much more research direction. When we get bone density scans, we're just checking one thing and its density, and we're not looking at the geometry of it. But I think it's super interesting when it comes to the swimmers for this, because they are super fit and they certainly get the muscle pull, but they're also in water, which is reducing that buoyancy is reducing the gravity pull too. So, and you add the endurance sports, so the low energy availability risks with it as well, which is always a big risk I talk about with the runners, as I'm sure you do too. But I think it's also quite fascinating. And I've had scenarios like this too, where we get their bone density and it's actually not bad. I would have expected it to be worse for someone getting a femoral shaft stress injury. But you have to remember that their bones may be developed in different directions and the geometry may be different. And we're not checking for that. So again, it's just one number. Ferritin is one number. Our thyroid is one number. The DEXA scan is one number, and taking all of that into context.
And I think the easiest way to put it is that bone lays down based on the force you put upon it. And so if you are jumping up and down or running, jumping from one leg to the next, that's the force that your bone is going to get used to having. If you don't have that force, if you're not putting that load on the bone, then it's not getting strong in that particular direction. And so that's why we need to get it strong in that direction. That's why plyometrics is really important and why you would load it slowly. So you wouldn't jump from that 20 miles to that 40 miles because that repetition is what is allowing the bone to lay down in a way that supports you. And so I think that's the easy way to put it. And then the other thing that you said, Sara, that I completely agree with, and I even think about one of our athletes in the track club, that this is true too, but like when your cardiovascular engine is so strong, sometimes your muscles, your bones, your tendons, and your ligaments just can't keep up with it. And that's it. So you have to actually slow down from that cardiovascular standpoint so that the rest of your body can catch up.
Right. And that actually, Kate, that's like serves as the basis for coming off bone stress injuries, right? So the cardiovascular may still be there because maybe you're able to train during at least part of your modified weight bearing period. And I always tell people, I'm like, when we start the return to run, you're going to want to do so much more and you're going to be so itchy to do more. I'm like, that's good. It should always feel that way. And after you do your, exact workout that you're supposed to do to build your bone, then you go get it on the bike or whatever your reduced forces option is, the bike, the pool, the elliptical, aqua jogging, whatever. But that's exactly, I think, what happens. And that's kind of mimicking the idea behind the swimmer going to the runner as well.
Yeah. No one ever likes their return to run. And I even can feel them getting angry at me. And I know I'm doing the right thing. I have to have the conversation with myself. Hold the line, Kate. Hold the line. It's okay if they don't like you. It's okay if they're mad at you. You're protecting them.
Sometimes I just have to finally say, I'm not bargaining anymore. I'm done. I've told you what I think. It's so hard. But I get it. It's hard being on the other side too, when you're just like itching to go and you're like, please give me 3 inches. And you're like, nope, because you'll take 3 feet, number one.
Right. All right. Well, let me rope this back in and let's say the number one takeaway from each of us for this particular case. So why don't you start, Kelsey, since you started us off?
Yeah, I think that it's just as simple as what Sara was saying, that like when you are noticing something that could be not optimal about your body, not just like simplifying it to one thing, just always asking what's the bigger picture of this. So it's not just the ferritin rarely, and making sure that you're going to the right providers to help you tease out all of the things that need to be considered.
Great.
Yeah, and I think history is so important here too, because if you didn't know this as a swimmer, you're missing a lot of really important pieces here that you could still get the gist of in terms of getting them the right direction. But I think the past is so important to ask what folks have been experienced with in terms of their physical activity, even ask them about their job. Whatever their activity looks like really predicts what you need to be doing next.
And I think I would pull maybe training error. For me, is training error is a huge, huge cause of injury. And so if you're not really sure what you're doing when you're training for your first marathon, your first 10K or whatever, ask for help. So many people try to self-coach, and I think the data says that 70% of people in the US are trying to coach themselves. And we have professionals that help with that, and that's running coaches. And then, of course, there's other providers like myself, PT, like Sara, like Kelsey, that you can talk to if you have questions. So... All right. Well, thank you so much for joining us again today for this episode. If you like this episode, please share it. Please rate it. Please pass it along. Send it to your friends in text message, whatever it takes to get the word out, because we love to help people out. And hopefully that you will gain something from this episode, or maybe one of your friends or running partners will. If you guys have a case that you want us to do or something you want us to talk about, please email us at runcasemiles@gmail.com. And we will see you soon.